Medical Tourism Corporation interview with Dr. Subhash Gupta, kidney, liver, and pancreatic transplantation surgery. Dr. Gupta's surgical training was in India and the United Kingdom. He has several journal publications, contributions to books, and lectures and conference presentations.
Subhash Gupta, liver specialist, and I do liver transplant surgery, I do liver resection for cancers, I do pancreatic surgery for pancreatic cancers. And I am a graduate and a postgraduate from Modern Institute of Medical Sciences, New Delhi. Subsequently, I trained in UK in hepatobiliary surgery in University of Birmingham Medical School, University of Birmingham Queen Elizabeth Hospital, and later on in St James's University Hospital in Leeds. And thereafter, I spent a lot of time in Far East, in Japan and Korea, where actually liver surgery is far more advanced than anywhere else in the world. And subsequently, came back to India and I'm doing hepatobiliary surgery. I am a member of the Royal College of Surgeons of Glasgow as well as Edinburgh, a member of British Transplant Society, also a member of the Indian Society of Organ Transplantation, Indian Society of Hepatopancreatic Biliary Surgery, and I had done many sort of surgeries which have been done for the first time in this part of the world, certainly, and certainly some for first time in the world. Our group has done the first living-related liver transplantation for portal biliopathy. We have to accredit the youngest child transplanted in India. We've also done the first combined liver-kidney transplantation in this country. We've also done first internal diversion for a very unusual condition called progressive familial intrahepatic cholestasis, internal diversion. So our group has a number of publications and well recognized all over the world as a leading liver center. Our patients for liver transplantation come from all over the world. Of course, we get a lot of patients from our neighboring countries such as Pakistan, Bangladesh, Sri Lanka, Mauritius, Maldives, Burma, Thailand. But also we get a large number of patients from US for liver transplantation, also from Europe, and in fact, countries such as South American countries such as Venezuela and other places. The reason for that is that living-related liver transplantation, very complicated business, and very few centers in the world do this routinely. Liver transplantation, as you know, can happen from cadaveric source, and because when it happens from cadaveric source, then it's obviously done in large numbers in Western countries. But within India and Far East, cadaveric organ donation is not that common, and therefore a lot of transplantation is from living-related members, and it's very complex surgery, and therefore there are very few centers that are sort of actively involved in this, and therefore we get patients from all over the world. Those patients who would not get a liver transplant done in US because of insurance reason, or sometimes there's a scoring system which is called the MEL scoring system, whereby liver is given not to the patient who is most disabled, but the patient who is most likely to die in the next few months. And as a result, many patients who are disabled because of the liver disease, but are still likely to survive for many years, will not have a liver transplant. We're not lacking in anything as far as equipment is concerned, and in fact, if at all, because help from colleagues is much more forthcoming in our part of the world than say in England and where I worked a lot. And in England, it's impossible to talk to a doctor after 5 p.m. unless he's on call. Whereas here, you can draw on your colleagues to help you out of a difficult situation. So I think working in India is much better in the sense that you get much more cooperation from your colleagues than you would get elsewhere. Currently, we do mainly living-related liver transplantation, and the best results for living-related transplantation is probably 90-95%. And if we look at all our results, that means we look at our cumulative data, then in the last overall we've had 87% long-term survivors after liver transplantation, across across the board. But of course, there are certain groups where we've had 100% success rates, such as in children and in fulminant hepatic failure, we've had 100% success result. And of late, in the last 2 years, we've had over 95% success rate in elective transplantation. If you only have a liver transplantation in India, it is essential, first of all, that somebody must have told you that you need a liver transplantation in your own country. Number two, there must be a family member of the correct blood group in the age range 18 to 50 who is willing to donate part of his or her liver for this person. Otherwise, it's pointless coming here for liver transplantation. Liver transplantation is a very good operation, but there are certain problems with liver transplantation. And the problem we, of course, acutely face in our country is that we don't have cadaveric organs, so we do mostly living donor liver transplantation. Although we've done over 200 living donor liver transplants and no previously healthy donor has had any problem, but still it's a major surgery for a donor, and this should always be kept in mind before getting gung-ho about liver transplantation in our
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.